Hello, my name is Michelle Ransom, and today I'm going to have a presentation for you for my English. I'd like to talk to you today about why we are giving our children cosmetic surgery at birth. You've probably all heard of this cosmetic surgery, and you probably don't think it actually is a cosmetic surgery because a lot of parents don't. The surgery is circumcision. Circumcision is the surgical removal of the foreskin on the male genital. It's usually done between the first 3 days of birth and heals in about 2 weeks, depending on the penis. This does leave a scar, but most people don't even realize the scar because it's right under the head of the penis. There's a couple reasons why parents are doing this. Parents think that it is cleaner and easier to take care of. Parents also think that this will make their kid fit in because they think it's more common and maybe their spouse or all their family members are circumcised, so they want to circumcise just because everyone else they know is circumcised. Um, there's also religious reasons. In the Jewish religion, you do have to circumcise to be in the religion. Um, they also think it might reduce the chance of their son contracting HIV. If you actually look into it, uh, this surgery is considered cosmetic because there is no real reason to. All the reasons that parents have for it actually have been proven false. And a lot of insurances won't even cover circumcision anymore because they think that it's cosmetic and not needed. Um, Parents think that circumcision is more clean than leaving the penis uncircumcised, but it actually has been proven not to be. An uncircumcised penis needs to be taken care of a little bit differently than a circumcised penis. The foreskin will retract on its own, and that's usually around 5 years of age. So before it retracts on its own, all you do is clean it, just like you would any other body part. Clean the outside. You do not want to retract the penis before it retracts itself because that's how a lot of parents cause infection because they're pulling it back when it shouldn't be pulled back. It will retract on its own. And once it does retract on its own, to clean it, all you have to do is pull back the foreskin and clean inside. There's really no difference to how you clean it. You just clean it with soap and water like you would any other body part. It's just important for parents to realize you should not be forcing the foreskin to retract. And other than that, it's basically kept clean like any other body part, and you don't have better hygiene if you are circumcised. You just need to clean your genital just like you would if you both, whether you're circumcised or not, needs to clean your genitals. Next, it has been proven that it does not um, prevent HIV or any other sexually transmitted diseases. Some people thought this, but when they did studies on it, they weren't using the segma, which is like kind of like a discharge that uncircumcised penises have. They didn't include this in their study, and they didn't include a lot of things. So it actually has been proven that it does not. And people thought it did because the time frame that they were using, the circumcised men couldn't even have sex for the first 3 weeks. So the uncircumcised men were actually having sex with more people for a longer period of time. Um, it also is becoming more common to leave your child uncircumcised. So the people that think that it will make their child fit in by being circumcised actually are wrong because in 1995, I believe it was 64% of children were being circumcised, and that has been decreasing ever since. So pretty soon, the normal thing is going to be uncircumcised. Leaving your son uncircumcised is natural. It's how we were made. So a lot of people think this is why we should. Also, you can be circumcised at any point in life. So a lot of parents think that they should let their son decide what he wants to do, if he wants to be circumcised or not, which this can be done at any time. If you let your son be uncircumcised, he can always get circumcised. But if you circumcise your son, he can never get uncircumcised because he's already been circumcised. You can't take away what you're already taken away. You can't put back what you're already taken away. And it also has so many nerve endings. This is actually related to, it'd be like taking off a woman's clitoris, and it actually hurts the baby. The baby does feel it, and a lot of men say it takes away some of the sexual feeling. It's not as intimate, and it feels better when they are uncircumcised. And a lot of women also say it feels better to have sex with uncircumcised men. I mean, that's all preference. There has been, everything that I've read, a lot of the majority of people prefer somebody uncircumcised. I think mostly what it comes down to is parents aren't doing their research. I interviewed two people, and the one really didn't even think about it. It's something a lot of people don't even consider or think about until they actually have their kid and they're in the hospital and they have this paper in front of them that says you want to circumcise or not, and they basically base their judgment on what their brother or sister, were they circumcised? Oh, well, circumcised because my brother was circumcised. Like, they're not thinking about all the data that has been put into it and all the new research that's there. But usually parents that do their research decide to not circumcise because they have done the research and they have seen that there's no reason really to be doing this. And even if their child wants it in the future, they could always go back and do it. Well, I'd like to thank you for listening and have a nice day.